Good
Yes.
evening.
Good evening.
Well,
I'm Drishti Sharma, a grade 11 student from Oberoi International School, and today I am here to talk about the Ayushman Bharat Healthcare Scheme. So, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, or PMJAY, is a national health insurance scheme launched by the Government of India in 2018. It provides rupees 5 lakh per family per year for secondary and tertiary hospitalization, covering around 500 million poor and vulnerable people. The scheme offers cashless, paperless treatment at public and private hospitals across India, aiming to reduce out of pocket healthcare costs, improving access to quality care, and move towards universal health coverage. Eligibility is based on the 2011 socioeconomic caste census data. To talk in detail about the Ayushman Bharat scheme, I'm here with none other than Dr. Indu Bhushan, the man behind the successful launch of the scheme and who was specifically called by the government of India to help set it up. To introduce Dr. Bhushan now. He is a retired IAS officer, is a distinguished leader with a remarkable journey spanning over 4 decades across governance, global development, and health systems. He holds a PhD in health economics and a master's degree in health sciences from Johns Hopkins University. He is also an alumnus of IIT Banaras Hindu University and IIT Delhi. Dr. Bhushan began his career serving in the Indian Administrative Service in Uttar Pradesh and Rajasthan. He has also worked as a senior economist with the World Bank Group in Washington, D.C., and then joined the Asian Development Bank, Manila, where he held several leadership roles, including Director General of the East Asia Department and Strategy and Policy Department. In 2018, Dr. Bhushan was appointed as the first Chief Executive Officer of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana by the Government of India. Recognized internationally for his contributions, Dr. Bhushan is the recipient of numerous awards, including the Population Award from the Government of Vietnam, the Global Achievement Award from Johns Hopkins University, and the E-Governance Gold Medal from the Government of India. He is also a proud recipient of the Gold Medal and Distinguished Alumnus Award from IIT BHU. Dr. Bhushan is now acting as an independent director on the board of several reputed organizations. Good evening, sir.
good evening.
Thank you for taking out your time and speaking with me on this issue, on this scheme, sorry. While I have given a basic idea about Pradhan Mantri Jan Arogya, which now I'll be referring to as scheme, so to avoid repetition, would you please let the viewers know about it more in detail?
Okay, Drishti. So you have given the basic details about the scheme. There is some hissing sound. Can you hear that? Or
That's a little bit, but I think it's
I think
okay.
it's okay.
Yeah.
So, before we go into the scheme, uh, it will be good to know that why the scheme was put in place by Prime Minister Modi
Yeah.
and Government of India. What happens is that when poor people get sick or anyone that becomes sick, so what happens that they have a option of either not taking the treatment because they can't afford it, or uh, taking the treatment by borrowing heavily or selling their assets. When they borrow heavily and sell their assets, what happens? If they're poor, they become even more poor,
Yeah.
and their ability to bounce back becomes even more weaker because they don't their productive assets have been sold,
Yeah.
or they can't take the treatment and they just have to die. And if the person happens to be the breadwinner, then the whole family falls into poverty. So, and this has been actually happening. It's not as fiction. There is a study which shows that every year millions of people, millions of families fall into poverty because of the expenditure on health. And so this scheme was put in place so that no one has to forego quality health care only because they can't afford it. And number two, no one should become impoverished because of expenditure on health. So that's why this scheme was put in place. And so here, like you mentioned, every family now actually there are more than 500 million people who are seeking care under this scheme, and so every family is covered up to 5 lakhs per year for any hospitalization or any major health expenditure they have to incur. And so there is a list of health conditions which are close to what 1500
Yeah.
for which the families are eligible, and there is a list of hospitals which are
Mhm.
now 31,000 where they can go, and when they go, it is cashless and it is paperless, so they don't have to take anything with them. In fact, they can just present their thumb, and with the thumb they can be identified whether they're eligible or not. And once they're eligible, they don't have to pay anything, and the whole system is paperless. And currently, just to give you an update, more than 20 lakh free treatments are being given every month, and more than 2.5 crore treatment every year. And this is actually saving uh, poor people, more than about 40,000 crores every year. So it's a within 7 years, you just like you're right that we launched it in 2018. So we'll be completing 7 years later in this year.
Yeah.
It's the right of 6.5 years. And if you'd asked me when I started the scheme that in 6 years' time you'll be providing 20 lakh treatment every month, I would have taken it. And in that sense, great success. Now every state in the country except West Bengal is implementing it. And Of course, the implementation pace of implementation is different in different states, and there are different kind of models. And I can come to that later. But I would like to stop here.
Okay. So my second question is what inspired you to join the scheme? If I recall correctly, that is, you were working with the Asian Development Bank before joining it. And so what motivated you to come
Hmm.
back to India and join the
Well, Drishti, yes, you're right. I was the Director General in Asian Development Bank, and it's a very senior position, very coveted and very cushy life. And it was, uh, I got a call from Prime Minister's office in sometimes in February of 2018, and they wanted me to implement this scheme, start this scheme. And I didn't think twice about it because, who gets a chance to implement a scheme which is so transformative,
scheme?
which is going to be changing the lives and supporting so many millions of people. People pay to do a thing like this because they want to make a difference in the world. Also, they want to support the poor. We go and do so many things to help the humanity. And this was the case which was being given to me in terms of uh, making a scheme, developing a scheme, implementing a scheme which could change the face of health sector, and also in the process help millions of people. And since I had done a similar kind of scheme or schemes in other countries like Mongolia, China, Vietnam, Bangladesh, also, and Thailand, it was a natural thing for me to come and do that in my own country. So I actually very gladly took it up. Just a anecdotal thing that coming here was the not that easy in the sense that I took about salary cut of about 95% because of course you have to come here on the government salary,
Yeah.
so which was about 5% of my salary in Manila. But money is not everything. I was looking for challenge. I was looking for the ability to contribute uh, to the health sector in the country, and so I very gladly came, and I am still remain very grateful to Government of India, Prime Minister Modi, that he invited me for implementing this scheme, and the kind of work that I did, kind of challenges, kind of uh, job satisfaction I've had it before. Mm.
Okay. So now that we've talked about your motivation to join the scheme, I
Mm.
also wanted to ask if there was any mandate that was required to you or like from you from the government of India.
Mm. So when I came in 2018, so I had a meeting with the Prime Minister Modi, and he said that Um, we need to implement this scheme. We start the scheme from 15th of August this year. And that was about end of March. So only 6 months time, implementing a scheme of that scale where, like you mentioned, more than 500 million people have to be covered for all the diseases. We also need to get all the states on board because, as you know, health is a state subject in our constitution. So we have to convince the states that you need to implement the scheme. And also getting all the hospitals on board, not only public hospitals, but private hospitals, and getting all the rules of the game, having IT system which can support this. Also, all the uh, agencies, establishing all the agencies which will be implementing and supervising the scheme. So it was a huge task and it had to be done in 6 months' time. So, of course, that mandate and creating a team which could implement this was, of course, a huge mandate. And and of course, since it was a mandate given by the Prime Minister, so it was mandate for the entire government. And so I got a lot of help from different parts, including civil society, consulting firms, international bodies, and government, various departments of government. And I didn't disappoint the Prime Minister.